Hello, I am Dr. Singh. I saw a patient who was taking testosterone and was admitted in the hospital because of blood clots and pulmonary embolism. When I asked him what was the reason for his blood clots, at first he was not upfront, but after probing and telling him that his hematocrit was above 54 and is he taking any anabolic steroids because he was well built and muscular guy. He explained that he was not only taking anabolic steroids but he was also taking testosterone. At that moment I explained him about polycythemia, means his blood was too thick and that was the reason why he was getting blood clots. Then I asked him the questions about testosterone. He did not know the questions about testosterone. And Emil, my medical student from Madras, he was rounding with me. I asked him to study the entire testosterone deficiency and testosterone access. And he not only studied, and he wanted to explain in a very layman language to the patient. Here is Emil, who's going to explain you the entire testosterone deficiency and its functionality in a very simple layman language. So Emil, go ahead and do it.
So, hello everyone. As Dr. Singh was just explaining, this session is based off of how testosterone can affect the body. And we are going to explain this in simple terms that everyone can understand, that's relatable to everyone, not just doctors, not just medical practitioners. So, let's start with the anatomy of the phallus. I have drawn the arterial system over here and the venous system right beside it. If you look closely, you can notice that there are these three big circles in both of them. These represent the main muscles within the phallus. Above, you've got the two corpus cavernosum, they're like the big caves. And below that, you've got the smaller spongial muscle. In easier representation would be a headphone with a sponge right below it. The two earmuffs of the headphones being the big caves. So let's start with this. If you look at the first picture, you can see I marked a few red circles inside. These red circles denote the arteries, and they are present within the muscles, mainly. And if you look at the second image, you can see that there are a few blue dots. Those represent the veins within the phallus. And these veins are all along the periphery of the phallus, not in the center. So there's a reason for this particular anatomic distribution. It is increased blood flow through the arteries, which result in the muscles getting engorged and the phallus becoming erect. So when this happens, these engorged muscles will in turn compress the veins which run through the periphery of the phallus. So how is this important? As I said, increased blood flow to the arteries will cause the phallus to become erect. But we need to maintain the erection. And that's where this anatomy becomes important. These engorged muscles compressing the veins will bring about a valvular action where blood cannot leave the phallus easily. This will result in the engorgement remaining prolonged and thus prolonging erection. So that is the first simple piece of anatomy. And why is this important? This blood flow part, that's what I've explained below. As you can see, this is an image of what happens within the blood vessel. I've shown the three main cells over here. The football represents the RBC, the tennis ball represents the WBC, and the smallest golf ball, it represents the platelet. What is the importance of these cells? So this is a simple system of a pipe with grease, and within that we got these three kinds of cells or balls. And this is important because in particular conditions, you will have erosion of the grease. Grease is essential for any kind of machine to function properly without friction. Now, when the grease is lost, you will have things collecting over there. The machine will start getting damaged. This is very similar to what happens within your vessels. When your endothelium is lost, you'll have your platelets and WBCs attaching to it. And along with that, the RBCs will also start clumping together. That is what is shown over here. And around it, connective tissue will start to gather. This is the basic form of an atherosclerotic plaque. So atherosclerotic plaque is nothing much, just your cell types within the blood along with a lot of fat. That's it, and connective tissue around it. So what brings this about? Can you turn it? Oh. Erectile dysfunction has various etiologies. We can divide it broadly into neurological, hormonal, vascular, substances and medicines, and finally psychogenic. So I am mainly explaining about the vascular part. So what brings about the vascular damage? It can be diabetes. High blood sugars will result in excessive fat within the body, and that can accumulate in such regions. Another one is inflammation. Any sort of inflammation that is prolonged can increase the risk of it. So it can be any kind of chronic infection, chronic inflammatory disease, but mainly smoking. So these kinds of chronic inflammation result in the loss of the endothelium. Now, that would eventually lead to erectile dysfunction. But the main crux of our topic is about erectile dysfunction and testosterone. So I'm going to explain how all of this comes together with this circuit diagram. For an erection, there has to be sexual stimulation or sexual thoughts. Now that often occurs within the brain. So that's why I have represented a cloud of sexual stimulation, and beneath that, the brain. So this acts like a switch in the circuit. Within a circuit, whenever the switch is turned off, the light won't light up. The bulb will remain dark. Now, once you turn on the switch, electricity can start flowing through the circuit. So the circuitry is your vascular system, which is what I showed initially. Now, along with that, there has to be a fuel that pushes it along, which is the battery over here, and that is your testosterone, the male hormone which is essential for erection. So when all of these factors come together, your vascular, neurological and psychological, and hormonal, you will have the bulb light up. And that's how erection works in simpler terms. Now, talking about testosterone, what happens when you have low testosterone other than erectile dysfunction? That's what I have explained over here. So, if you look over here, I have represented the brain.
Emil, can you come on this side, please?
Okay. So if you look over here, it looks like a bit of a complicated diagram, but once you get the terms together, it's gonna turn easy. What happens to the heart of a mad dog? It dies. Now, what do I mean by all of these random terms? So, if you look at the heart, H stands for heart, E for endothelial dysfunction, then you have your androgen receptors, the AR, and finally T, testosterone and thyroid hormone. So whenever either of these are affected, especially the testosterone thyroid part, you will have MAD happening. What is MAD? Loss of memory, Alzheimer's dementia, and depression. Now these three will lead, so along with these three, the DOG part also comes in. Diabetes mellitus, osteoporosis, and gonadal atrophy. Now, coming on to this diagram, this part shows the head of a human, which is, as I said, where the person goes mad. And then here you have the heart. So, coming back to our main part, the testosterone, when you have a deficiency of this, testosterone, as I said earlier, your vessels will get affected. It could be along your main vessel, the coronary arteries around the heart. It could be the vessels that move down, the aorta, or any of its branches. And finally, it comes down to the gonads and the prostate below. So the vasculature to this TAP, which is the testis and the prostate being affected, will result in decreased blood flow. And this decrease in blood flow will further reduce the testosterone, because when your testis doesn't have enough blood, it won't be able to function well. So it goes in both directions. Now, because of this testosterone deficiency, you can have coronary disease, peripheral artery disease, and then bone and testicular dysfunction in the long run. So that's what I have explained again in the diagram on this side. I think we can turn it a bit. So low testosterone can damage the heart, as we just explained, and a bad heart can damage the testes and thus in turn cause low testosterone. So it goes both ways. But as you can see, one of the arrows over here is very thick and the other is thin. Why is that so? Because there are many ways in which low testosterone can affect your heart. And there are many studies which prove that. And the other way around is less so. But as I said, it becomes a vicious cycle. And with that, I would like to conclude the class for now. So at the end of the discussion, it brings us back to the case that Dr. Singh was talking about. What made that person develop DVTs and pulmonary embolism? So as Dr. Singh had just left it at a cliffhanger. Through more questioning, as he had mentioned, we had found out that the patient was taking testosterone. So testosterone, as I just showed over here, is essential for the body to function, for your heart to function. But what happens when you have it in excess? The normal levels of testosterone is between 300 to 800. So what do you think your testosterone levels are? 300, 500, 800, or thousands? So this is where medication control becomes essential. Whenever you're taking a medication like testosterone, it needs to be monitored over time. You need to keep monitoring it. Otherwise, you can have the damages of having excess testosterone. It could result in hair loss. It could result in excessive masculinity showing up as anger problems. They can have loss of control, and they can develop clots in excess. So in that particular case, the patient had a testosterone level over 1000. The treatment was pretty simple. We had to treat the DVT and we had to limit his testosterone intake for a while. And everything went back to normal after that. So everyone needs to know that testosterone is important, but in moderation.
And if you don't need it, you don't have to put testosterone in your body.
And so testosterone has its own role in males and females. It's essential in both sexes. But if you don't need it, you don't need to take it into your body.
Observerships, doodles, CVs, interviews, we help you match stronger. Contact me at connect@drsinghmd.com.